Can scoliosis be fixed? And what are your treatment options? Scoliosis can affect the spine in several ways. First of all, it causes an unnatural sideways curvature of spine to develop. And as a result of this spinal curvature, the spine also rotates or twists in a front to back or back to front kind of situation. The curvature or the twist typically occurs into the concavity of the curve. This disrupts overall spinal biomechanics and affects overall spinal function. The question that people ask is, okay, I've been diagnosed with scoliosis. Is scoliosis curable? Scoliosis is a progressive condition, and it is nature to progress it and worsen over time. Scoliosis is completely incurable. We normally, in most cases, we don't know the cause, so we can't know the cure. But in majority of scoliosis cases, it is highly treatable. We can influence the progressive nature of scoliosis, especially if things are caught early. Can scoliosis be completely fixed? Now, scoliosis or fixing scoliosis, meaning it really means achieving a corrective result. Corrective results normally include reducing the size of curvature on a structural level, actually making the spine straighter than it was when it was initially diagnosed, and normally increasing the strength and stability of the spine so the spine is optimally supported by the surrounding muscles and tissues so it doesn't regress back and holds this normal position. There are very different approaches to dealing with trying to get corrective results in scoliosis, and they're normally broken down into two specific branches: surgical approaches versus non-surgical approaches. A lot of patients will ask me, well, can chiropractors fix scoliosis? There's a very big difference in treating somebody with scoliosis versus actually treating somebody's scoliosis. General chiropractic, even condition-specific chiropractic care, can help patients that have scoliosis that experience pain. But treating somebody's scoliosis requires specific knowledge and a combination of treatments to actually get the spine to move back into the right alignment. And this is normally involved by taking the most tilted vertebra and not only just using typical manual chiropractic adjusting, but maybe combining many modalities to deliver a very specific approach to curve restoration or reduction. Doctors or chiropractors who focus on scoliosis, they know scoliosis, and they're normally trained in many specific treatments and modalities to help achieve this result. So what basically is that getting adjusted just because you have scoliosis versus getting treated for your scoliosis are two different things. And scoliosis can be approved without surgery. And surgery is a spinal fusion process that's normally very invasive, it's costly, and it's a very lengthy procedure. And like with any surgical procedures, there's many complications that can occur, risks, and side effects. Surgery can make spines straighter, but it does it at a cost. And this cost is in spinal health and function. Basically, it's making the spine straighter, but it's limiting motion and mobility because it is fusing the spine together with rods and screws. So it's getting the spine straighter, but it's doing it at an expense, and the expense is motion and function of the spine. Conservative or non-surgical approaches will try to reduce the spinal scoliosis, but while maintaining normal function of the spine or normal movement of the spine, so it's a more functional approach. By definition, surgical approaches are non-functional because they are making the spine straighter and eliminating movement and function, where conservative approaches are trying to make the spine straighter while retaining normal movement and function. Conservative approaches, I like to call them chiropractic-centered treatment options, can have very proven results and can have very significant results on the size of scoliosis. So what are the different treatments that are associated in this conservative treatment option? Well, all these treatments are very condition specific, meaning it's going to really depend upon the patient's scoliosis size, severity, and the patient's age. But one thing is chiropractic care. Chiropractic care works on a very structural level to help reduce the scoliosis. And normally chiropractic care can be broken down into something we call scoliosis specific adjusting, where we're using adjusting protocols to help manage patients on a structural level to help reduce their scoliosis. Normally, a second component is a combination of in-office therapy. In-office therapy can be broken down into two specific categories, something called passive therapy and active therapy. Both these things are working on a structural basis to help make the spine straighter, and by increasing strength and spinal stability, wherever we perform these adjustments, that these therapies will help help amplify or work in conjunction with the chiropractic care that was done before. Corrective bracing is also something that we use to help correct and move the spine into a better position. The difference between corrective bracing and traditional bracing is corrective bracing is actually pushing the spine, where traditional bracing is just squeezing and holding the spine. Corrective bracing can have a very profound effect on a patient's symmetry and torso alignment relative to their spine. And the last thing is going to be customized home exercises. Now, home exercises that are customized as a result of somebody's scoliosis, it's very different than general exercise for strength or stability or strength or fitness. Fitness or general strength exercises have nothing to do with scoliosis progression, and therefore they have nothing to do with stopping scoliosis progression. These are customized programs based upon the scoliosis presentation, and they're prescribed to help stabilize the scoliosis progression and hold a reduction for long-term sustainable results. Here at Scoliosis Reduction Center, we really offer a complete proactive conservative treatment option with proven results over time to help stabilize a patient that has scoliosis and stop scoliosis progression. We can't cure scoliosis, but we can definitely reduce the size and achieve corrective results by reducing the scoliosis. A patient will receive all the benefits of having that curve reduction. And the best thing, all this is done in one office, coordinated by one doctor, so everything is very cohesive and working together, and nothing is fragmented, so the patient can get the very best results possible. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.